Welcome back to another episode from the Optimal Body Podcast. I'm DocJen.
And I'm Dr. Tom.
And today we're talking about groin pain, that pain that you get high into the groin there. Why does it happen? What is the research saying? And what should you be doing? So as you can see, it is just easier for us to have our computers out in front of us so that we could really just hit those key research points without trying to memorize it, so that you really have the information that we feel is quite pertinent to understand, so that you can continue to go upon your pain journey and hopefully find the solutions that are best for your body. Now, of course, if you have more questions as we go through this or other recommendations that you find have worked for you, please leave it in the comments. It helps to, have this discussion. We're not the ones with all the answers, so we want to hear from you as well. And don't forget to hit the subscribe button, because we have so many more episodes, whether they're PT related episodes or just things that you can do, movements you can do within your own body with quick videos as well. So hit that subscribe, leave us comments, let us know how you're feeling.
I feel like most people will feel this pain high up into the groin, kind of close to where your pubic bone is, which makes sense. That's near where a lot of our adductor muscles attach, which are the adductor muscles essentially are the groin.
Mm-hmm. Yeah, so adductor, these are the muscles that bring your legs close together.
They add the legs together.
Yes, but these muscles don't just connect up high into the groin. They also go all the way down and attach into the knee, like right below the knee. So I think it's important to remember that we can have pain anywhere along this leg, but we also need to assess and be aware of the muscles going all the way below our knee, all the way into our groin. And we even have some of our hamstrings that pull our leg back, but also help to pull our leg in. So it's kind of looking at this whole picture and then how our fascia connects from those adductors even up into our abs.
A lot of the research that we have in front of us was done on athletes, which I think is one limitation of the studies we're going to be looking at. But what are human beings other than athletes of life?
There you go.
So we are all athletes in our own regard, just trying to move through life successfully in a way that we feel fulfilled. So finding out how we can apply this to the general person, I think there's a lot of things that can carry over. Some of the patient reported things for people who are having groin pain was the presence of pain on the adductor squeeze test. So kind of having something between your knees, whether it's a pillow or just your fists, squeezing those knees together. That caused pain. Reduced strength score on an adductor squeeze test, so feeling like the strength was reduced one side versus the other. Reduced range of motion in hip internal and external rotation. Also altered trunk muscle function, which makes sense. Anytime we're feeling pain in the hips, we might be altering how our core and our hips are coordinated with each other, because we're guarding against certain movements.
And what do you know, when we look into the research, something that is very effective treatment is strengthening. I feel like we are repeating the same thing on a lot of podcasts, but movement, we are physical therapists, so we're going to promote movement here, right? But if we look at the research, we are seeing that available evidence suggests that exercise, particularly strengthening exercise of the hip and abdominal musculature, could be an effective intervention for athletes with groin pain.
Human athletes
with groin pain.
Again, they go on to say that it may need to be in the form of progressive exercise from static to functional to be more effective. If it ever sounds like we're repeating ourselves with many injuries, especially soft tissue injuries, it has kind of the same framework of healing and progressive rehab. Step one is calm it down, which during the calm it down phase, we're doing comfortable range of motion, comfortable active movement of the joint as we're able to.
Isometric holds.
Different isometric holds. And as that kind of creeps into phase two, where we start to do more strengthening, whether it's the isometric holds or strengthening through the range of motion. Often we'll use what we call more open chain exercises, where you're not doing it against your body weight, but you're doing it more through leg lifts or active.
Like you're not standing.
You're not standing doing like a lateral lunge as much as you're
laying on your side,
doing exercises against resistance bands or just against gravity. And then step three, we start to move into more of the functional things like the side lunges, the Copenhagen planks, which we're going to talk about later on. And then if you're looking to get back to sport or something more explosive, then we work into the plyometric stuff. So there's always that kind of similar progression.
It's important to note, there's just less evidence to really really support the use of passive treatment. So think of passive meaning you're not moving your body, someone is doing something to you, and medication as co-interventions with exercise program for groin pain. So it's just, you could do it if it helps you to feel better, if it helps you to relax your muscles before you go into movement, that's fine. But there's less evidence to really support its need. And
that's what the evidence showed, is that it was slightly effective at, especially in some of these athlete studies, at getting the person back to sport, but it didn't have as great a long-term impact as doing exercise.
And even if that were to take the pain away, well, then why did the pain come in the first place? What were we avoiding? What were we neglecting? Where we may be weaker in a certain area or don't have the range of motion and active mobility in a certain area that caused that pain in the first place? So if we're just relying on passive treatments and not doing active treatments, well, then we might fall into the same pattern and needing the same treatment again and again and again.
What exercises do we do then?
Yeah.
Or what are ways that we can start to load this adductor region? And there was one research study that specifically talked about the Copenhagen plank or Copenhagen adductor exercises in a 12 or 8-week study where participants did these Copenhagen exercises. This type of training resulted in a significant increase in adductor longus muscle thickness and hip abduction movement after 8 weeks of the training. And point B is that these changes were reversed after 4 weeks of detraining, right? So that's always the unfortunate thing about exercise. You can feel good and get great changes in your body after just 8 weeks or 12 weeks of training, but then our body detrains fairly quickly. And there are a ton of research studies in detraining, and it's like once you reach a certain functional level, the amount of work that you have to do to maintain that functional level is like 25 to 30% of what you were doing to get there.
Right.
So if you're training 3 days a week to get to a certain functional level, even if you get to a point that you're very happy, you have very minimal pain, you're doing the activities that you want to do, and then you just do it once a week after that, you can keep yourself at that functional level because your muscles already have the patterning, the neuromotor patterns into the muscles and through your nervous system. So just doing them once a week keeps that fresh. Favorite exercises? What are some of your favorite adductor exercises? And we'll start with the ones that are more mobility based. So these would be ones that you're going to do a little earlier on in an acute groin pain.
Mobility wise, I always go into like adductor rocks. I think that's such an easy one to kind of hit, and you can gauge your range of motion based on how you're feeling. So what people get wrong with the adductor rock is when you're on all fours and you have your leg out to the side. And what people do wrong is that they kind of round their back and sit toward their heel. And not, again, that's wrong. It's a different way to do it. You're going to get a little more hamstring with that. But if you keep the back straight, and we're really just trying to increase that pool of pressure from the groin all the way down to the knee, then you really want to think of keeping that tailbone almost pointed up toward the ceiling as you start to lean back, because that keeps more of that back flat and you get more of that pressure into that high groin area. And that's where you're going to feel where your range of motion really is and how much range of motion you want to start to work in toward.
Yeah, and there's great progressions of the adductor rock when you want to start maybe putting more tension through it, like being able to press your foot down into the ground, because then you're in more of an active, hey, I'm lengthening, but I'm also putting kind of an isometric pressure through that muscle as well. At the beginning, we talked about how people will have limited internal, external rotation range of motion. This is where something like the 90-90, the hip 90-90 can be great, where from that 90-90 position, you can stretch both external rotation by leaning towards your front leg and internal rotation by kind of sitting into that back hip. 90-90 can be tough for a lot of people. One of the first things I recommend is tucking the legs in so your knees aren't exactly at a 90 and you'll still often be able to feel the stretch, especially if sitting in the 90-90 itself is very uncomfortable, or elevating the hips by putting a little pillow under your back hip.
It's a quick kind of thing that you can do on someone, or you could do on yourself if you roll or do something to kind of relax the tissue tension of your inner thigh. Or, well, first you want to test how much internal range of motion you have. So lay on your back, grab your leg, and kick your ankle out to the side. If it barely moves, try to massage the inside of your leg. Do it again. You most likely are going to see an increase in that range of motion. So that hip internal rotation is really restricted based on the tightness that we might have in that hip inner thigh. Something that you have to keep going to, improving that mobility, improving that overall range of motion in the hip is going to help with that groin strain. And then, we talked about the 3 different levels of our Copenhagens. I love starting just on the ground where you're in a side plank, but your bottom leg is out in front of you and your top leg, you just have your knee on the ground. So both knees are bent, bottom leg out in front of you, top knee is going to be on the ground. Usually I put a pillow there and then you lift into a hold. And if you can, you lift your bottom leg off the ground. It's honestly super hard. So your leg might stay on the ground as you lift up.
Super tough. And for those of you who might just be listening and aren't familiar with what a Copenhagen is, like a full Copenhagen plank is when it's almost like you're in a side plank, but your top leg is sitting up on some sort of bench or chair or something. So you're essentially using the inside of that thigh to hold yourself in a straight plank. Where we go from what Jen just outlined, where your knee's on the ground and you're doing it from the ground, is can you then put your foot on the ground and lift yourself into that plank?
So hard.
Raise the bottom leg. If you're able to do that, then can you elevate the foot? But even before you do it on the foot,
I would do it on the knee.
Do it closer to the knee, where you have your knee on a chair or a bench or something, and can you lift yourself into that plank? And then you can always move it down to the foot. And there's all sorts of other fancy variations that you can do.
I mean, you can even go from like the knee to below the knee to mid shin to the ankle. Like you can work your way progressively just down the leg, because the more we go from your knee being on a surface to your foot being on, we increase that lever arm and that pressure that the muscle has to undergo. We talked about that connection up into the rectus abdominis, so up into your core, right? And so if we do just exercises, core-based exercises, squeezing a ball, so you can think of so many different things, right? From laying on your back and doing more dead bug type exercises, squeezing a ball. You can do planks, squeezing a ball. A lot of things where you're creating that tension from the adductors from squeezing something together, but then also including the pelvic floor and that inner core to kind of work together with you. That's going to help to build that connection across that pubic symphysis.
Standing functional type exercises where you're doing more just lateral lunges from side to side, really pulling through that adductor, doing adductor pulls. What do you call them? Side lunge pulls, where you kind of pull the weight.
Lateral lunge, weight drag. I don't know.
Yeah, there's like ones where I always see Jen doing them and they're really tough. Or doing an adductor slide where you have your foot on like a towel and you slide your foot out into kind of a side lunge and then slide back in. Super tough.
And if you want to be guided in some of this, because I know, again, saying all these things are great, maybe trying to add it into your life is helpful, but if you need a little bit more guidance, we do include these in our hip plan on Gen Health. And so it's 8 to 15 minutes. You'll get mobility, stability, some core, and you really start to highlight a lot of these areas. We're not going to overdo it because it's not just a groin plan, but it's a whole hip plan. So we're going to work every aspect of that hip. And if you want to go into Gen Health and just explore, you get a week free to start. And then we have a special code just for you. So code OPTIMAL will get you $5 off of the hip plan. Well, any of the plans really.
There's 11 plans. So
there are 11 plans currently, each with different phases. So you're getting a lot of content on here, and we're continuing to work and bring you more. But essentially that's $20. So if you want to just explore what the 30-day plan is for the hip, because it's a 30-day plan, you'll get guided day to day. It keeps track of your progress. You can always double up if you miss a day, or you just miss a day and you just continue on. It really is a helpful tool to be able to follow. You hear my cueing throughout, you see me doing it, so you're really guided. And that's my goal, is to have me in your ear. So even if you leave Gen Health, you go on to other exercise protocols, you hear my cueing so that you remember how to move most effectively and optimally for your body.
So there you go. All the information about hip pain and what you can do about it. Do you have any thoughts? Are you somebody who's experiencing hip pain? Have you found things that are helpful? Please comment below, or comment with other topics that you want us to cover in podcasts like these. Before you go, please consider hitting the subscribe button and notification bell. We have so many of these podcasts that come out, and Jen also has incredible movement videos that take you through all the exercises. If you want to get into our hip plan in Gen Health, check out the link below. We have a little discount code for you as well to get a discount on that first month, and we'll see you next time.